Good morning. Welcome to NBC 10 at Issue. I'm Tracy Davidson. Today we begin with a doctor who says he has heard enough excuses from his patients for not getting vaccinated against the coronavirus. He says their hesitancy is based on misconceptions and misinformation. And now he's fighting back and says his message is especially important for members of the Black and brown communities to hear. A recent study by the Kaiser Family Foundation finds about 35% of Black Americans say they do not plan to get the vaccine. With me now is Dr. Daniel Laroche. Dr. Laroche is an ophthalmologist with a practice in New York City. He's also an assistant professor at Mount Sinai School of Medicine. Doctor, thanks for being with us today.
Thank you for having me.
So your mission is to convince people that the vaccine is safe and effective. Tell me some of the biggest misconceptions that you continue to hear from your patients and others.
Yeah, so unfortunately, my practice is in a predominant African-American community where a lot of patients are receiving bad information, such as the vaccine can kill them, the vaccine can make them infertile, the vaccine is dangerous, it's not tested, things of that nature. And we know from our clinical trials that the vaccine is very, very safe. Even today, we know that those that have been vaccinated have only mild disease at most. They do not get severe disease. So it's very important for everyone to get vaccinated. Here in New York City, rates in the African-American community is about 50% in terms of fully vaccinated, whereas in other communities, as high as 70 to 80%. So there's still a lot of resistance out there. So it's very important for everyone to get vaccinated because it's very, very safe. Just recently, this morning, one of my staff, her mother was COVID positive, had an asthma attack, and had to go to the hospital. She was able to be successfully discharged because it was mild. And my staff person is currently on quarantine, okay? I have another patient recently who was scheduled, needed to have cataract surgery because she's becoming blind in one eye from cataracts. But because she was not vaccinated, we couldn't schedule her elective surgery. And when I asked her why she didn't want to be vaccinated, she goes, "Oh, I just don't know. I just didn't want to take the vaccine." And so there's a lot of misinformation out there. So we have to get the information that's correct to let people know that it's safe, so that we can continue to move beyond this pandemic.
I'm curious about the patient who couldn't have her elective cataract surgery. Did she change her mind?
Well, I asked her to go get the vaccine because the hospital requires that. And then I also let her know she will need a COVID test as well 3 days before her surgery. The hospitals are very strict with this. And also from another perspective, you really don't want to get COVID because if you do get COVID and you have severe disease, you cannot have visitors in the hospital. You'll be alone in a hospital by yourself without family and friends that can come visit to come give you support. And many people have died, unfortunately, that way. And it's the same thing. You don't want to get your family member to become COVID positive because you won't be able to go visit them at the hospital. And many families have suffered tremendously from that separation and from that loss. It's completely preventable. Right now, we're having a second peak in New York City. There are about 4,000 cases a day. That's expected to double over every couple of weeks. Because we're going through another wave right now. So it's really important. We can prevent deaths, prevent severe hospitalization with vaccination.
Of all the reasons that you're hearing from people of not getting vaccinated, do they differ depending on someone's race? Do different races sort of present different ideas about why they don't want to be vaccinated?
Well, within the African-American community, because of the history of slavery and segregation, there's far fewer Black physicians and medical officers in those communities. So people don't have access to that correct information. And also, there's a history of discrimination with the Tuskegee experiments and experimentation. And some people use that and refer to that as for fears. Today is a different day, though. We have clinical trials that have shown the vaccine to be very effective. We have both white and Black scientists and physicians that have participated in the trials. So we know it's very, very safe. So it's not the same as it was, 30, 40 years ago. And so it's very important for people to understand that, to receive that information, and to protect themselves and the people around them.
What about the Hispanic, Latino, and Asian communities? What do you say when you hear something from one of your patients from those communities in terms of this isn't safe, it hasn't been tested? What are they saying?
Well, the Asian community actually has the highest risk of vaccination. Their numbers are in the 90% range. Within the Latino community, there's been a language barrier. Sometimes people are not getting information because of language. I mean, I know in New York City, for example, the New York City Department of Public Health is doing a lot of advertising and education, but it's more so in English. We have to increase resources in Latino communities and through Latino media in Spanish to get that information in the Spanish language to those communities so they know it's safe as well. So I think that's where there's a breakdown. We have to put more resources in the communities that are highest risk, that have the lower vaccination rates. And then also, we have to have the private and the public sector provide incentives, whether it's gift cards or whatever incentives your business could do to get people vaccinated. And then also, what also works is mandates. We have mandates now in New York City where you can't go into a restaurant unless you're vaccinated. So that's working. Everyone in the school system has to be vaccinated. So those type of mandates work as well, because you're always going to have some stragglers that don't want to get it done. And we have to, make sure everybody's safe and protected.
We have a success story here in Philadelphia. Dr. Ayla Stanford, she launched her own COVID testing and vaccine clinics. Now she has one clinic that's open. She realized that the Black community here was underserved, as it is in many communities. She went right into the community, made the change. Why do you think that's not happening more often, that somebody is just not taking the bull by the horns in every community saying, we have to reach this community, we have to serve this community?
Well, my practice is in the African-American community in Harlem and in Southeast Queens, and we do that every day with the patients that we speak to. Most of my patients are elderly and high risk, and we always have that as part of a conversation with my examiner, asking them to be ambassadors for me with their friends and family and people in the neighborhood. So absolutely, we need more resources, more people. We have to diversify a more diverse workforce and devote resources to those communities, to Black media, to educate African Americans through the media that they watch as well, and to Afro-Latino media as well, to Latino media. So definitely resources, more manpower to educate, to overcome this is absolutely important.
Pharmaceuticals are developing these antiviral pills that will be used for treatment. Are you hearing from people who say, well, we'll just get the pills and we'll just take it instead of being vaccinated?
No, I'm not hearing that so much. The most disturbing thing that I'm hearing, where people just don't want to take it, they want the quote freedom to not take the vaccine. They want their freedom or their rights. And that's really bad information, because the people who are speaking like that have no scientific platform, no scientific basis for that. And unfortunately, a lot of these people are doing, when they talk about this quote freedom, it's really they're pursuing a freedom more to unfortunately discriminate and to not have a mandate. And from my analysis of this, during the civil rights movements, when African Americans were fighting for freedom, for integration and equal opportunity and against discrimination, there's been a backlash on the right talking about, oh, well, they want certain freedoms to not have these mandates so they can have, unfortunately, the freedom to discriminate. So any mandate you provide, you have these right-wing radicals that will say, hey, we don't want that. We want freedom. We want freedom. And that's where a lot of the rhetoric is coming across, putting bad information about the vaccine, which is not scientifically based at all. So we have to be aware of that. We have to fight that. Unfortunately, a lot of these people that are on the right and not getting a vaccine, many of them have gotten infected and died. And in many cases have been detailed in the media. So that's more my concern at this point.
You've also said that people who don't get vaccinated don't deserve to take up a much-needed hospital bed. Is that true? And do you believe that?
No, but I said at the time when we get into a peak of the pandemic, we want everyone to be vaccinated. But there are some people, there's a minority group of people who will refuse to get vaccinated no matter what, okay? They refuse to get vaccinated no matter what. And so those people, they think that they just want to fight it off. If they want to ride it out without the vaccine, then they should ride it out without the vaccine. But the good news is that we do have other treatments. For example, some of the oral pills that we could take and the oral antiviral pills that we could take. We do have remdesivir, which is an intravenous treatment. We do have antibody treatments that can take place as well. And so we do have those. Those are much more expensive, okay, and require hospitalization for many of these things. The pills are not readily available. So you shouldn't count on that because those might not be available for you. And then also a hospitalization can be prevented with a free vaccine that you can get.
Dr. Daniel Laroche, we'll have to leave it there. Thanks for sharing your perspective and thanks for your time today.
Thank you so much. My pleasure.